is reporting a surge in Covid-19 cases again. There are two new variants, the NB.1.8.1 and LF.7, both sub-lineages of the Omicron variant that have been detected in India lately. There are fresh cases that have been reported from Maharashtra, Karnataka, Andhra Pradesh and Delhi, with Kerala being the worst hit, having reported 273 cases in May alone. The Union Minister has said that it remains vigilant and proactive in monitoring the situation closely. The World Health Organization has put this variant at low risk but warned about the transmissibility of it. Advisories have cautioned people to abide by the COVID precautions but not panic. Let's start this conversation, find out more about this new variant of COVID that is spreading fast across the cities in our country, especially in Karnataka and in New Delhi, Kerala, Andhra Pradesh. Joining me on the telecast is Dr. Sanjeev Bagai. Dr. Bagai, first of all, this sudden increase in the number of COVID cases, the newest variant that has been detected, and there are a large number of people that have been infected by it. How cautious should we remain?
Good evening. So I think COVID has always been there. It's been there for the last 5 years, even after the last wave of the initial phase of Omicron. Various sublineages have come up from time to time. Internationally, more than 1,750 subvariants have been known and isolated. The one in India, which is being isolated right now, is JN.1. This is not a new variant in India. It had also shown to be diagnosed around 6th of October 2023 in Tamil Nadu. So what JN.1 is, it's a breakaway of the BA.2 family of Omicron. It either transmits and evolutes from the XBB strain, or it can add what we call as a flip variant, which is LS.455, and become what we call as JN.1. During this mutation, this extra mutation on the spike protein, what this does is it has more transmissibility at the cost of decreased binding to the ACE receptor. So therefore, it can transmit from human being to human being a lot more, but the infectivity, the lethality of it goes down. So it's a trade-off. But more importantly, this is perhaps one amongst the most immune escape mutations which we have known in JN.1. And when I say that it is one of the most immune escapes mutations which are there in JN.1, the reason is that it has gained a lot of unique mutations apart from the flip mutation, but it has lost approximately 24 selective mutations. What this has done is that it has created an ideal recipe in which you can have vaccine escape infections, or past infections don't give you that much amount of natural immunity as herd immunity. So the bottom line is that we have to be cautious. We should wear a mask in crowded places, especially in summer months when we are traveling. We need to take adequate precautions. Remember that this is an airborne infection. It is not lethal. The hospitalization rate is very, very low. The case fatality is near nil at the present moment, but precaution is always better than being sorry at a later stage.
Okay.
Lastly, what I want to mention is that when you say in terms of getting a subclinical infection, or indeed a mild infection, or an asymptomatic carrier status, you are still susceptible to develop long COVID. So long COVID is an entirely different chapter, but it exists worldwide in about 20% of people who've been exposed to it. Cognitive effects, kidney, liver damage, eye infections, a host of systems are involved. So it's best to prevent this infection.
Okay. More importantly, how would an individual be able to escape themselves from this latest mutation? Can there be more vaccines that can be administered to a person, or precaution is the best offense?
So, in terms of the vaccines, India is extremely well placed with a population of 1.4 billion, which is about 145 crores. We've given 220 crore vaccines all put together. Almost 95% of the eligible susceptible population has been vaccinated twice. The boosters to the elderly and the people with comorbidities has been given. So over a period of time, you develop what we call as a cross-reactive protection, and over a period of time, a community-acquired immunity. So we are reasonably well placed. The newer vaccines which are available are what we call as the bivalent vaccines, or what we call as target vaccine. So JN.1 vaccine is available internationally, although it's an mRNA vaccine. But at the present moment, we don't need to think of vaccinating for this particular strain in India. We don't need to keep any antivirals. We don't need to be thinking of hypoxia and oxygen demand. But the hospital systems are well geared up. They've been told what to do. The Indian healthcare system in the last 5 years, although has been extremely robust and good, is extremely well driven by systematic scientific protocols.
Dr. D.R. Rai, if you could also tell us more about the advisories that have been issued by the Health Ministry. The hospitals and the health staff have been put on alert, talking about how there needs to be an increase and the readiness of beds, of oxygen, of vaccines. Is there likelihood that there could be a possibility that patients will have to be admitted to hospitals to fight the disease, or is this something that can be resolved, a solution be found with medication provided by the doctor's prescription?
Megha, you are right, absolutely right in that way, because this time this COVID sign and symptoms are very, very different as it were in the 2020 and 21, which we were seeing. This is a mutation of the microbes also, and as Dr. Bagai has explained each and everything about the mutation, how many times this virus has mutated. And if you remember in the beginning when the COVID was at the peak, I used to say every time, now we will have to live with the COVID-19, because otherwise, as an off and on, this virus will come and go. As you have seen the last 4-5 years also, some sporadic cases are there or are there. But now, as far as the preparation and the anxiety is concerned, we should not be worried at all. Those persons who had taken the vaccines, they are very safe. But only thing is, this is a airborne virus, and the spreading is very fast than the last microbe was one. But only thing is, the advisory as the government of India and the health department has issued, they are well prepared. Even they have instructed to the hospitals to keep the beds ready, to keep the oxygen. But till today, we have not seen any admission. I mean, very, very few persons has to go there. There is no hypoxia. There is no need of oxygen. Even the antiviral medicines are not giving. Symptomatically, they are getting clear. But again, I would like to say from your media to my own all public of our country, we have to be cautious that whatever the protocols we have observed during the 2020 and 21, let's start that immediately, so that we will be saving ourselves also, and we will be saving our kinship also. Because going to the crowded places and not observing the hand hygiene, others, this is the only thing which will trouble us very badly. So there is nothing to worry for that one. And as far as the vaccines are concerned, the vaccines are available in the market, but still I think it will not be needed at all, and we should not worry, but we should take all the precautions which were told in the 2020 and 21.
Okay. Dr. PSV Rao, what are the precautions that one can take to fight and to ensure that one is not transmitted with this new variant? And what are the difference in the symptoms an individual may encounter if he has caught the newest variant, the latest mutated version of COVID-19?
Good evening, Megha, to the panelists and the viewers. These symptoms are the same as before. There is nothing new about it, except the fact that coronavirus 19, this COVID-19 virus, has mutated to an extent where it is spreading even in summer. Rhinoviruses, the influenza virus, and the various cough and cold viruses usually peak in winter. You don't see much of it in summer. But what we are seeing of this COVID-19 now the latest variants and the earlier variants is that they are spreading in summer. And symptoms are the same. And as to your question on precautions, it is the same as before. I've always advised everyone to continue using the N95 mask and use it and avoid crowded places, avoid going to such places without a mask. Please use the mask, use the regular hand hygiene, etc., because by touching a contaminated, maybe a door handle, maybe any other object, and then you touch somewhere, you scratch your nose or bring it near to you, you can get infected. That is the precautions to be taken. Thirdly, there is no need to panic. There is no need to fear. Unlike the original pandemic, when we didn't know what the virus, anything about the virus, we didn't have vaccines, nothing. Whereas now we know what the virus is just a variant of it, and the various vaccines still have some effective. It may not be as effective as some of the old variants, but definitely still effective. And do remember, it is 5 years since the original pandemic. There are a whole lot of children born after the pandemic who don't have immunity. Their parents need to be very careful so that they don't bring it to the children. And all the children who were not vaccinated that time, because we weren't sure if the vaccines will be safe for children, they are all now youth. So they also need to be, if required, vaccinated.
Okay.
And those who have been vaccinated may need a booster dose.
Okay. Yeah, that was the question. Dr. Bagai, again, can an individual voluntarily go to a hospital or a clinic and demand that he be vaccinated, keeping in mind that there are reports that it's 5 years have elapsed? So the effects of the vaccine that was taken, the 2 vaccines, sometimes even the 3rd booster dose that was taken, the effects may start waning now.
Yeah, so the vaccines which have been given initially during the alpha wave, the Indian vaccine in the Indian context were made for the wild strain. That was the initial original strain. The strains which have mutated post that, the initial vaccines will not hold that good right now. Primarily for the Omicron, because this is one of the most immune escape subvariants, JN.1. The initial vaccines, be it Covishield or Covaxin, will not hold that good. The protection rate would probably be less than 10 or 20%. This is about what the published data states as far as the immune escape is concerned. This present JN.1 is 210 times more immune evasive than its parent strain, which is BA.2.86. The vaccines which are available internationally are strain specific. So JN.1 or a bivalent vaccines, these are available internationally. But at the present moment, we do not need the vaccines which are being promoted overseas because the case fatality is low. Simple precautions, masking, social distancing, hand washing, and avoid crowded and poorly ventilated places. No need of vaccine at the present moment at all.
Okay. Dr. Rai, then should we treat this newest mutation of COVID as a regular cough and cold, or do we need to be more wary of its side effects and therefore be more cautious in dealing with it?
As I had told you in the beginning also, because the original virus in 2021 was there, now symptoms are quite different. At that time, people were having some cough, cold, etc. But now the patient who are coming with this positiveness, they are not complaining of any cough and sneezing, etc. But they are complaining of severe body pain. It is severe body pain that sometimes we, even as a doctor, we think, what the hell has happened to you? Otherwise, you are looking very nice. There is no hypoxia is not there. Otherwise, other things are not there. But he is having a severe body pain, and even sometimes they are having a nausea also. But again, I am saying you, this is because of the mutation only, and number of times it has mutated also, and they are evasive. So we have to be very cautious. Only our precautions will save us. There is no need of the medicine. There is no need of the hospitalization and others also. we should avoid crowded places. If there is no need,
Okay.
don't go to the market. But if you have to go, always use N95 mask. Whenever you are coming back to house, immediately sensitize your hands, wash your hands thoroughly, then only enter, then only touch your children and others. And rightly it has been told, those children who were born after 21, their parents has to be little cautious as far as the infection is concerned.
Dr. Rao, what happens in case a person contracts this variation of COVID, the newest variation of COVID-19? Is the treatment possible sitting at home, and what should the family members and the patient keep in mind?
Mega, even during the pandemic, even during the lockdowns, we were telling people stay at home and take care of yourself unless you start getting breathless, and then only we were asking them to come to the hospital. We can't be causing panic and telling everyone, please come to the hospital. And those days, there were many people, because the pulse oximeter prices came down, we encourage a lot of people to buy their own pulse oximeter, check their oxygen levels. If your oxygen levels start dropping, please come to the hospital. Then we can may have to treat you more aggressively.
Okay.
Secondly, continue to take all the precautions and don't spread the virus to others. One, you have picked up the virus by going without proper protection or whatever, you didn't take the proper precautions. Having got it, kindly stay at home, use a mask, and don't spread it to other members of the family, and don't spread it elsewhere by going around and roaming around. So this is a request. Public needs to be also responsible and help themselves and others.
Dr. Bagai, can we get over-the-counter medicines from chemists and treat ourselves in case we detect a variant of COVID in our body?
Okay, so in a systematic bullet point form, the only medicine which is required to be taken at home is simple tablet paracetamol, either 500 milligram or 650. For children, there are syrups available. The dose needs to be calculated. You can take this medicine every 4 to 6 hours, depending upon your body weight, for 2 or 3 days. If your fever is high, if your muscle pain or headache is very severe, you have vomiting or any other symptoms like breathlessness, only then consult your doctor. If your fever especially is crossing day 2, definitely consult your doctor. There is no need of any antibiotics to be taken. In fact, antibiotics can cause more harm in this situation than good. You can get superadded opportunistic infections. No other NSAIDs such as painkillers or fever medicines. Specific medicines like ibuprofen or nemosilide or aspirin should be strictly avoided. Like I said, no antibiotics in any case, and no antivirals need to be stocked at home. There is no need to panic at all. These variants will continue to come even in the next few months, maybe for a couple of years more. This is here to stay. We need to learn and adapt ourselves to live with it in a safe manner. Like I said, only paracetamol, consult your doctor, stay safe, no panic. Isolation is the key. If you have cold, cough, fever, stay at home for a few days till the symptoms subside. If you're going to a crowded place, especially now in summer months in airports and aircrafts, do wear a simple mask.
Dr. Bagai, have you seen a surge in the number of people complaining of contracting the newest variant, coming to you and seeking your prescription?
At present, we haven't. I mean, off and on somebody comes and complains. At that time, 3-4 days before, we were not thinking it is again a COVID only, because patients were coming with only body pain and little fever only. Then we used to think in that way, because the weather is changing. Sometime it was raining, it was very hot. Then it started raining. So change of the weather was also responsible. But now, once it has been publicized by the media also, now we are thinking about this one. And we are advising to each and every patient coming to us, if they are coming with high fever or with fever and body pain, kindly keep yourself isolated in your own house.
Yeah.
Don't get contacted with your own family members, because you are responsible for saving your family also. Second thing is, if you are having some fever or body pain, for 2-3 days you take rest in the house only. Don't go outside, otherwise you will be spreading, because it's sneezing and respiration, because it is an airborne virus. So you definitely you are going to spread it. So we should take our own precaution to save ourselves and to save others also.
Dr. Rao, can the COVID test, I don't know about their availability, if they are still freely available in the market currently, but can these COVID tests detect the newest variant in your body?
It is obviously detecting, that is why these cases are being reported. I think in between, like Dr. Rai said, we stopped ignoring, looking for the COVID, because we said, okay, there is a whole lot of these host of viruses. Covid19, like every other virus, airborne flu kind of symptoms virus was going on. But now that there is a obvious resurgence, people have started testing. So you are going to hear more and more numbers of this. And these tests are picking it up. It is not that they aren't picking it up. The variants, the problem is more with the vaccine rather than with the tests.
Okay. All right. On that note, I thank all of you for joining me and sharing all this important information, critical information with our viewers, so that they do not panic. They take all the right steps and precautions. Don't become, completely go berserk because there has been a COVID strain that has been detected in your body or in the body of your family member or a neighbor. You need to take the right precautions. You need to take your bed rest. You need to isolate yourselves, and within a few days' time, you will automatically heal after having taken those precautions. If there are adverse effects, if your oxygen levels breach a certain mark, then you obviously have to go to your doctor, go to the clinic, go to the hospital to get admitted. But those cases are far and few in between. In fact, there have not been any single case thus far that has been reported that has been mandated to take the patient and be admitted into the hospital so far across the country.